Caring for Mother-Baby Couplet from Germany by Emily Shilley and Shayla Fontaine. Although there are numerous similarities that exist between the birthing experience in the United States and in Germany, there are also notable differences that we as nurses should be aware of. As healthcare professionals, we have a responsibility to provide patient-centered care by ensuring cultural beliefs are acknowledged and respected. The major differences between the countries mostly pertains to the way the government handles pregnancy as a whole. In Germany, new mothers are guaranteed ample paid time off from work and will typically receive full insurance coverage for all medical costs. However, in the US, the assistance provided is generally not as generous. It is important that we educate our patients that are accustomed to such practices about the inconsistencies in healthcare standards and policies to be sure they understand just how their experience will differ here in the United States. Pregnancy. Women in Germany typically have one provider throughout their entire pregnancy and then a different provider who delivers their child. Usually, this starts as a physician and transitions into a nurse midwife. This is generally due to the fact that most hospitals do not provide both prenatal care and delivery services, with the exception of a few private clinics. Therefore, a patient that is used to a swap in a provider may not be bothered if their usual physician is unavailable at the time of delivery. Prenatal care during pregnancy in Germany involves a similar appointment and testing schedule as the typical schedule in the United States. A woman's first appointment is usually 8 weeks after conception for an internal vaginal ultrasound. Following appointments occur every 4 weeks up until week 32, and then every 2 weeks until the due date. If the mother makes it past her due date, appointments occur every 2 days past this date. Although prenatal appointments and overall care is similar, a German woman in the United States may expect more ultrasounds than what is typical for the US. Most US insurance companies only cover one ultrasound during pregnancy around weeks 18 to 20, while in Germany, the National Hospital Insurance grants every woman 2 free ultrasound screenings. These are typically done around weeks 16 to 20 and 30 to 35. We should educate our patients about the differences in healthcare and insurance policies so that they can understand what type of care to expect throughout their pregnancy. In addition to prenatal screenings and appointments, a mother from Germany living in the US might also expect to receive a book called a Mutterpass, otherwise known as a mother's passport. This is given at the first prenatal appointment and contains all information about a woman's pregnancy, including appointments, test results, and due dates. This must be brought to every appointment and to the actual delivery, as it allows for a woman to deliver at any German birthing facility. Although women in the US do not get a formal booklet containing all information, we as healthcare providers can be cautious of this and provide alternative documentation if the patient is looking for something similar. Women from Germany can learn a lot about pregnancy from medical providers themselves. It is common for physicians to hold question and answer sessions at their facilities daily and to show birthing videos each month. Here, they are taught about prenatal care and the importance of exercise. Women in Germany are highly encouraged to participate in gymnastics-like classes beginning around the 5th month of pregnancy. These classes promote relaxation and breathing techniques that make the labor process much more comfortable. However, they are exclusively for the mothers, as fathers cannot attend. Women looking for something similar to this in the US may benefit from Lamaze classes, which will also teach numerous tools that may be helpful to the mother during labor. As mentioned briefly earlier, it is important for the nurse to be aware that in Germany, maternity leave works a little bit differently than it does here in the United States. Women that work for a German company will actually have mandatory time off before birth and after birth of their baby. Up to 6 weeks before and 8 weeks after their birth, the mother will continue to receive full salary from the government and her employer while she cares for her newborn. Prior to birth, we must educate our patients about the differences that exist pertaining to maternity leave in the United States because here, you are certainly not guaranteed paid leave. Labor. The 3 most common birthing locations in the US are hospitals, birthing centers, and home births. Today, the majority of births occur in hospitals due to a lack of services in other facilities. It is important to educate our patients on these options so that they are able to weigh the pros and the cons of each and make their own decision. In Germany, a nurse midwife, called the Hebamme, delivers approximately 80% of all births. A physician is typically present but only assists in delivery if complications arise during the birth. For this reason, we must be aware that people from the German culture may not know that midwives are only present upon request in the U.S. We should reassure our patients that while this is not standard practice in the U.S., it is certainly an option. The United States can be quite conservative compared to other countries, especially in regards to nudity. It is not uncommon in the German culture for nudity to occur, especially during the birthing process. We must keep in mind that some women may not be used to using sheets to cover up during procedures or using private changing rooms to change for ultrasounds and examinations. Similarly to the United States, women typically do not endure childbirth without some form of pain-relieving medication. In Germany, about 50% of all mothers opt for an epidural, while others may prefer a form of local anesthesia or a more mild analgesic. However, over the years, German providers have become somewhat hesitant to utilizing epidurals as they have found it increases their emergency C-section rates. In the United States, oxytocin or Pitocin is often used to strengthen contractions in hopes to progress the labor process. However, in Germany, it is mainly only used if contractions were to stop mid-labor. As a nurse, it is important we are aware of this dissimilarity and be sure to explain to the patient the reason for the drug as well as its advantages and disadvantages. Furthermore, we should reiterate that this is their experience and that they have the right to refuse any medication that they do not see fit. Birth. The C-section rate in Germany is similar to that of the United States. 15 to 25% of all births typically occur this way. However, the care after a C-section differs between countries. In Germany, following a C-section, women remain in the hospital for 10 to 12 days. In the United States, after a C-section, a woman only remains in the hospital for 3 days. Additionally, in Germany, fathers are not allowed to be present during a C-section, while in the United States, with the mother's consent, a father is allowed in the operating room. In Germany, a mother's second birth, the one that happens right after the C-section, is always attempted vaginally unless the reason for the C-section was due to a pelvic disproportion. In America, although a vaginal birth after a cesarean birth is common, it is not always recommended or the first option. Patients typically have to express a desire to attempt a vaginal delivery post-C-section. It is important to educate our patients that this is an option if they are eligible to try and deliver vaginally after C-section, even though it is not the first thing suggested by a provider. Immediate postpartum care. In Germany, women are given the choice whether or not they want to participate in rooming in with their new infant. Approximately 40% of new mothers will choose this option, while the remaining will begin the healing process in a separate postpartum unit. Regardless of their choice, the baby will almost always be moved to sleep in the nursery each night. The father of the baby is not considered a visitor and may come and go as he pleases. However, siblings under 14 years old are not allowed in the unit. Women are encouraged to eat their meals in the unit's dining room where they can chat with other patients who also recently gave birth. Since U.S. hospitals differ depending on the facility, it is important that we educate families about hospital-specific policies so that they know what to expect. Breastfeeding is common in both Germany and the United States, but the duration that it lasts tend to differ. In Germany, about 80% of mothers will go home breastfeeding, but only last about 3 to 6 weeks on average. In the United States, women are encouraged to breastfeed exclusively if possible for the first 6 months and then slowly begin to introduce other foods. Similarly to the US, in Germany, solid foods are introduced around 5 to 6 months. However, in addition, babies are also given Kindertee in between feedings, which is an organic tea made from specialized herbs and is believed to settle and relax baby bellies. However, the concoction contains a lot of sugar, and research has shown a relationship between its use and baby bottle mouth syndrome, a condition that leads to early tooth decay. Health professionals are responsible for providing patient education regarding the importance of hydration for the baby and why the U.S. does not recommend sugary drinks such as Kinder tea. However, parents may not be receptive to this idea, so be aware and supportive of their personal opinions. In Germany, once you and baby are discharged, the Hebamme will typically visit you at home each day for your first 10 days after delivery. After this, she will visit approximately every 2 to 3 days until about 8 weeks postpartum. She will help with a variety of tasks to assist with caring for the newborn, including, but not limited to, breastfeeding and bathing. In the United States, the nurses provide teaching and education to the mothers and fathers during their short hospital stay, but do not typically follow them into their homes. However, if the patient requests additional services, visiting nurses can be arranged to visit her at home and provide support upon discharge. For this reason, it is important to always ask about the mother's support systems at home and whether or not she may need extra help. Although in-home nursing care is not a universal practice in the United States, it is something that can potentially be set up if necessary.